I became a hospice nurse because I thought I was good with death. That sounds strange, I know. Nobody's good with death. But some people are less bad at it than others, and I was one of those people. I could sit with someone who was dying and not fall apart. I could hold a hand that was going cold and keep my voice steady. I could look at a family in the worst moment of their lives and say the right thing, or say nothing at all, which is sometimes better. I had a calmness about me in those situations that my instructors noticed during clinicals, and that my first supervisor at Greenfield Hospice called a gift. It wasn't a gift. I know that now. But at the time, I believed it. I believed I was built for this work the way some people are built for teaching or carpentry or medicine. I believed that my ability to be present in rooms full of grief without drowning in it was a talent, something inherent, something mine. My name is Claire Alderman. I'm 38 years old. I've been a registered nurse for 14 years, 11 of them in hospice care. I'm telling you this because I need someone to understand what I did and why I did it. And I need to tell it from the beginning, so it makes sense. Or as close to sense as any of this gets. My first patient was a man named Walter Tench. This was at Greenfield, a small hospice facility on the east side of town. 12 beds, mostly older patients with terminal diagnoses, cancer, end-stage COPD, heart failure. Walter was 71, lung cancer, given about 3 months when he was admitted. I was assigned to him on my second day. He was my introduction to the work. Walter was a quiet man, former machinist, big hands, thin body. The cancer had eaten most of him by the time I met him. He didn't talk much, and when he did, it was usually to ask for water or to tell me that the light in his room was too bright. His wife visited in the mornings and sat with him and read aloud from the newspaper. His son came on weekends. Ordinary family, ordinary death. That's what I thought. Walter died 11 days after I started caring for him. His prognosis was 3 months, 11 days. The doctors weren't alarmed. Cancer is unpredictable. Some patients hold on longer than anyone expects, and some go fast. Walter went fast. It happens. I charted the decline, the rapid loss of appetite, the sudden drop in oxygen saturation, the confusion, the agitation, the final slide into unresponsiveness. And I filed my notes, and I attended the family meeting, and I moved on to my next patient. Her name was Dorothy Sims. 83, congestive heart failure, prognosis of 4 to 6 weeks. She died in 9 days. After Dorothy came a man named Robert Kang. 77, renal failure. Prognosis, 2 to 3 months. He died in 2 weeks. After Robert came Eileen Marsh. 69, pancreatic cancer. Prognosis, 6 to 8 weeks. Dead in 12 days. I want to be clear about something. I did not notice the pattern at first. Death is the expected outcome in hospice. Every patient I cared for was going to die. The only question was when, and when is always a guess. Prognoses are estimates based on the average progression of a disease, and individual patients deviate from averages all the time. 4 patients dying faster than expected was not, on its own, remarkable. It was within the range of what you'd call bad luck or statistical noise. It became remarkable around patient number 8. His name was James Oliveira, 64, ALS, one of the youngest patients I'd worked with. His prognosis was generous, 6 months to a year, because ALS patients can linger, especially with proper respiratory support. He was still talking when I met him, still cracking jokes, still eating solid food. His wife brought him lunch every day from a Cuban restaurant he loved. James died in 16 days, from walking and talking to dead in 16 days. ALS doesn't do that. It's a slow disease. It grinds people down over months and years, not weeks. The attending physician reviewed the case and noted the decline as atypically rapid and suggested that there may have been an underlying cardiac event that accelerated the process. There was no autopsy. There rarely is in hospice. I started keeping a notebook after James, not because I suspected anything specific. I didn't have a theory, didn't have a hypothesis. I just had a feeling, a vague, nagging sense that something was off about my caseload. So I wrote down the numbers: patient name, diagnosis, estimated prognosis, actual time from my assignment to death. I went back through my records and reconstructed the data for my first 7 patients. Then I kept logging, going forward. The numbers were not good. Over my first year at Greenfield, I was primary nurse for 23 patients. The average prognosis at admission was 11 weeks. The average actual survival from the date I was assigned was 13 days. Not 13 weeks. 13 days. 13 days across 23 patients, with diagnoses ranging from cancer to heart failure to COPD to ALS to kidney disease. Different diseases, different organs, different mechanisms of death. The only common factor was me. I looked at the numbers for the other nurses too. I pulled facility-wide data, going back 3 years. The average survival for patients assigned to other nurses roughly tracked with prognosis, some shorter, some longer, clustering around the estimated timeline the way you'd expect in a normal distribution. My patients were outliers, not slightly, dramatically. A standard deviation analysis would have flagged my caseload as anomalous within the first 6 months. But nobody ran that analysis. Nobody ever does. Hospice facilities track outcomes for regulatory compliance, but they're measuring things like symptom management scores, family satisfaction surveys, whether the right medications were administered at the right times. They're not measuring whether one nurse's patients are dying 5 times faster than everyone else's. Why would they? The patients are supposed to die. The whole point of hospice is that these people are dying, and we're helping them do it comfortably. If they die a little faster, well, maybe the disease was more aggressive than expected. Maybe the initial prognosis was too optimistic. Maybe it's just the way these things go. Nobody looks for the wolf when the sheep are already in the slaughterhouse. I didn't tell anyone about the notebook. I didn't tell anyone about the numbers. I told myself that I was being paranoid, that I was seeing a pattern where there wasn't one, that 23 patients was too small a sample size to draw conclusions from. I told myself all of the reasonable things, and none of them made the number go away. 13 days, 11 weeks to 13 days. That's not a statistical anomaly. That's a cliff. Around the same time, I started noticing something about myself, about the way I felt in the rooms. Every nurse knows the feeling of being in a dying patient's room. It's heavy. The air is different, thicker somehow, charged with something you can't name. Some nurses describe it as a presence. Others describe it as an absence, a vacuum, the space where the person used to be already forming before the person is gone. I'd always felt this, from my very first day. I assumed everyone did. But I started to realize that what I felt wasn't quite what the other nurses described. They talked about heaviness, about sadness, about the emotional weight of witnessing death. What I felt was different. When I was in the room with a dying patient, especially in the final hours, I felt good. Not happy, not anything as crude as happiness, but steady, grounded, focused, like the best, most centered version of myself emerged in those rooms, in those moments, when the body was shutting down, and the breathing was changing, and the family was crying, and the person in the bed was leaving. I felt nourished. That's the word I kept coming back to. I felt nourished by it. The way you feel after a meal when you've been hungry all day. Full and calm and complete. And when I wasn't in those rooms, when I was at home, on my days off, doing normal things, I felt empty, restless, hungry in a way that food didn't fix. I'd sit on my couch and I'd feel this low, constant pull, like something was tugging at the center of my chest, drawing me back toward the facility, back toward the patients, back toward the rooms where people were dying. I thought it was dedication. I thought it was vocation. I thought I was one of those nurses who was so committed to her work that she felt incomplete without it. I told my husband, Mark, that I was just passionate about the job. He said he was glad I'd found her calling. He was supportive. He was always supportive. He'd rub my shoulders when I came home from a shift and ask about my day, and I'd tell him the sanitized version. The version where I was helping people die with dignity, not the version where I was feeding on their deaths, like something from a nightmare I couldn't wake up from. But I didn't know that version yet. Not then. Then, I was just a nurse who loved her work. I should tell you about Walter Tench's death, about the specific moment, because that's where it started, and I didn't understand that until much later. Walter died on a Tuesday afternoon. I was with him. His wife had gone home for lunch. His son was at work. It was just me and Walter in the room. His breathing had been irregular all morning. Long pauses followed by rapid, shallow gasps. The pattern they call Cheney-Stokes. I was adjusting his morphine drip and checking his positioning when his eyes opened. He hadn't been conscious for 2 days. His eyes had been closed, his body still, his mind, as far as anyone could tell, gone. But now his eyes were open, and they were clear, and they were looking at me. Not through me, not past me, at me, with a focus and an intensity that I had never seen in a dying person before. He reached out and grabbed my wrist. His grip was strong, impossibly strong for a man who weighed 90 pounds and hadn't moved voluntarily in 48 hours. His fingers wrapped around my wrist and squeezed, and I felt something pass through the contact. Not electricity, not heat. Something else. A current. A transfer. Like something moving from him to me through the point where his skin touched mine. His mouth opened. He said something. I leaned in close, my ear near his lips, trying to hear. The words were barely there. Air more than sound. A whisper that was almost less than a whisper. I couldn't make them out. Not a single syllable. Just the shape of speech without the substance. Then his grip released. His hand fell to the bed. His eyes closed. His breathing stopped. Walter Tench was dead. I stood there for a moment with my wrist tingling where he'd held it. Then I did what nurses do. I checked for a pulse. I noted the time. I called the doctor. I called the family. I prepared the body. I moved on. But the tingling didn't stop. Not that day, not that night. For weeks afterward, my wrist, the exact spot where Walter's fingers had been, felt warm. Not hot, not painful, just warm, like a low-grade heat source had been implanted under the skin. I wore long sleeves. I didn't tell anyone. The warmth eventually faded, or I got used to it, and I stopped noticing. I should have noticed. I should have paid attention to the warmth and the tingling and the feeling of something being transferred. But I was 24 years old, and it was my first patient death, and I didn't have any framework for understanding what had happened. So I filed it away with all the other things I didn't understand about dying, and I went on with my work. For 11 years. 11 years of patients dying faster than they should have. 11 years of doctors shrugging and saying it happens, and families grieving on accelerated timelines, and me, standing in the center of it all, feeling steady and nourished and complete. I did the math once, late at night, sitting at the kitchen table with my notebook. Over 11 years, I had been primary nurse for approximately 260 patients. If the average prognosis was 11 weeks, and the average actual survival from my assignment was 13 days, then the total time lost, the weeks and months that those people should have had but didn't, was approximately 570 years. Combined. 570 years of life that evaporated the moment I walked into the room. I put the notebook away after that. I couldn't look at it anymore. But the numbers didn't stop accumulating just because I stopped counting. The thing that finally broke me was a woman named Angie Reeves. 52, breast cancer metastasized to bone and liver. She was young for hospice, young enough that her kids were still in high school. 2 boys, 16 and 14. They visited every day after school and sat with their mother and did their homework on the fold-out table in the corner of her room. Angie was alert, oriented, in moderate pain, but managing it. Her prognosis was 2 to 3 months. She was expected to see Christmas. I was assigned to her in early November. She died on November 19th, 18 days. Her boys were in the room. The 16-year-old was holding her hand when her breathing stopped, and the sound he made, not a cry, not a scream, something between the two that I'd heard 100 times before but that hit differently this time, stayed in my head for days. The 14-year-old was in the corner, headphones around his neck, a textbook open on his lap. He looked up when his brother made that sound, and his face went through about 6 expressions in 2 seconds: confusion, recognition, denial, understanding, and then something that settled into place like a door closing. He closed the textbook. He didn't cry. He just closed the textbook and put it in his backpack very carefully, like the textbook was the most important thing in the world. Like if he could just get the textbook into the backpack neatly, everything would be okay. I have seen hundreds of people die. I have seen families destroyed by loss in ways that would break you to hear about. But that 14-year-old boy, putting his textbook in his backpack while his mother's body cooled, that is the image I carry. That is the one that plays behind my eyes when I close them. Angie should have had 2 more months, maybe 3. She should have seen Christmas. She should have been there when her older boy got his driver's license. She should have had time to write letters, to say the things you need to say, to prepare. I took that from her. Not intentionally, not maliciously, but I took it. I went home that night and I sat in my car in the driveway for an hour before going inside. Mark came out to check on me. I told him I'd had a bad day. He brought me tea. He rubbed my shoulders. He was kind because he is a kind man, and he didn't know what I knew, which is that I had killed Angie Reeves. Not with a needle, not with neglect, with proximity, with presence, with whatever was living inside me that fed on the process of dying and accelerated it the way a bellows accelerates a fire. The next morning, I requested a transfer. I told my supervisor, Linda, that I needed a change, different unit, different patient population. She was understanding. Burnout is common in hospice, and she'd been waiting for me to show signs of it for years. She transferred me to the medical surgical floor at the hospital next door. Acute care, post-operative patients, people who were expected to get better. I lasted 3 weeks. The first patient who died was a 60-year-old man recovering from a hip replacement. Routine surgery, no complications. He was on my floor for post-op monitoring and physical therapy. His name was Glenn, and he was the kind of patient nurses like. Cooperative, cheerful, cracking jokes about the hospital food. He was walking with a walker on day 2, eating full meals on day 3, talking about going home on day 4. I was in his room changing his dressing when it happened. His face changed, went slack, then tight, then a color I'd seen too many times. Gray, waxy, the color skin turns when the blood decides to go somewhere it shouldn't. He grabbed his chest. Not the dramatic clutching you see in movies. A slow, confused pressing, like he was trying to feel for something that had shifted inside him. He looked at me and said, "Something's wrong." And then his eyes rolled back. The pulmonary embolism hit him like a switch being thrown. 1 second he was there, the next he was gone. A massive clot, the kind they call a saddle embolus, blocking both pulmonary arteries simultaneously. The code team worked on him for 30 minutes. I stood in the corner of the room and watched them crack his chest for internal cardiac massage, watched them squeeze his heart with gloved hands, watched the blood pool on the floor in a spreading lake that reached my shoes. His ribs made a sound when they spread them, a wet, splintering crack that I'd never heard before because hospice patients don't get coded. They're allowed to die. Glenn was not allowed to die. He was supposed to go home. He was supposed to walk his daughter down the aisle in June. They called it at 11:40. I cleaned the room. I mopped the blood. I changed the sheets. And I felt full. The second was a woman in her 40s, in for gallbladder removal. Laparoscopic, minimally invasive, outpatient level procedure. Her name was Diane, and she had 3 kids under 10 and a husband who brought her flowers the morning after surgery. She developed sepsis on day 2. By day 3, she was in the ICU. I visited her there. I shouldn't have, she wasn't my patient anymore. But I went anyway, drawn by the pull, by the hunger. She was on a ventilator, her body swollen with fluid, her skin mottled purple and yellow, where the blood was breaking down beneath the surface. The infection had spread to her bloodstream and was attacking everything simultaneously. Liver, kidneys, lungs, multiple organ failure. The ICU nurses said her blood pressure was being maintained by 3 different vasopressors, and she was still dropping. Her blood had stopped clotting. They were transfusing her constantly, unit after unit, and it was running out of her IV sites, and her mouth and her nose as fast as they could put it in. Her husband was in the hallway, sitting on the floor, holding the flowers he'd brought her, which were wilting. By day 5, she was dead. The surgical team reviewed the case and found no source of infection. The incision sites were clean. The instruments were sterile. Nothing explained it. The third was a 28-year-old man. Appendectomy. His name was Carlos. He died of cardiac arrest on day 3, sitting up in bed, talking to his girlfriend, mid-sentence. Just stopped. His heart simply quit, the way a machine quits when you pull the plug. No warning, no arrhythmia, no underlying condition. A healthy 28-year-old heart that decided to stop beating. They coded him for 45 minutes. His girlfriend stood in the hallway and screamed his name over and over, the same word repeated until it lost all meaning and became just a sound, a raw, broken sound bouncing off the hospital walls. Nothing worked. He was gone. 3 patients dead in 3 weeks on a floor where the mortality rate was normally close to 0. The hospital launched an investigation. They reviewed protocols, tested equipment, cultured the air vents and water supply. They found nothing. The investigation concluded that the deaths were unrelated adverse events and recommended enhanced monitoring. I knew they were related. I knew the common factor. I knew because I felt it. That same nourishment, that same fullness, every time one of them started to decline. I could feel it happening before the monitors caught it. I'd be standing in the room and I'd feel the pull, the draw, the feeding, and I'd know that this person was going to die, and that I was the reason, or at least the mechanism. I quit. I walked into Linda's office and told her I was done. She thought it was the deaths on the med-surg floor. She thought I was traumatized. She offered counseling, time off, a gradual return. I said no. I handed in my badge and my scrubs, and I walked out of the hospital and I drove home, and I told Mark I'd resigned. He was concerned but not panicked. We had savings. He made good money as a project manager for a construction firm. He said I should take some time, figure out what I wanted to do next. Maybe go back to school. Maybe try a different kind of nursing. Pediatrics, dermatology, something without death in the job description. I nodded and agreed and said the right things, and inside I was vibrating with something that wasn't anxiety, and wasn't relief, and wasn't fear. It was hunger. The thing inside me, the thing I'd been feeding for 11 years without knowing it, was hungry, and I'd just cut off its food supply. The first week at home was fine. I cleaned the house, cooked meals, did laundry, normal domestic things. I felt the emptiness, the restlessness, the pull, but it was manageable, like a craving that you can acknowledge and move past. I don't need to go back. I don't need to be near dying people. I'm fine. The second week, my mother had a stroke. My mother, Helen, was 74. She lived alone in a condo about 20 minutes from us. She was healthy, walked 2 miles every morning, played bridge on Thursdays, volunteered at the library. No history of cardiovascular disease. No risk factors beyond her age. She had a stroke while making breakfast on a Tuesday morning, collapsed on the kitchen floor, and was found by a neighbor who came to check on her when she didn't show up for their morning walk. The stroke was moderate. Left side weakness, some speech difficulty, but she was expected to recover with therapy. I moved her into our guest room so I could care for her during recovery. Daughter and nurse. I'd take care of her the way I'd taken care of hundreds of patients, except this time the patient was going to get better. She didn't get better. Within 3 days of moving into our house, my mother's condition deteriorated. The left side weakness progressed. Her speech got worse, not better. She developed difficulty swallowing. The rehab doctor was confused. This wasn't the trajectory a moderate stroke should follow. He ordered additional imaging. The scans showed no new strokes, no hemorrhage, no explanation. Just a brain that was shutting down for no discernible reason. I watched my mother die the way I'd watched 260 strangers die. The same progression, the decline in appetite, the increased confusion, the agitation followed by lethargy, followed by the deep, unreachable sleep that precedes death. I watched it, and I recognized every stage, and I felt the thing inside me feeding on it, drawing sustenance from my mother's dying, the way a parasite draws blood from its host. The worst part was that I knew exactly what was happening at every moment. I knew what it meant when she stopped being able to swallow her pills. I knew what it meant when her hands started picking at the blankets. Terminal restlessness. The body's confused attempt to do something, anything, when the brain is shutting down. I knew what it meant when her breathing changed to that rattling, wet sound that families always ask about. I'd explained that sound to hundreds of families. It sounds worse than it is, I'd say. She's not suffering. The fluid is just pooling in the throat because the swallow reflex is gone. I'd said those words so many times they had become automatic, meaningless. Now I was hearing that sound come from my mother's mouth, and every word I'd ever used to comfort a family felt like a lie I'd told to keep them still, while the thing inside me finished its meal. She died on a Wednesday morning. Her breathing slowed, and then there was a pause that lasted longer than the others, and then there was nothing. I was sitting next to the bed, holding her hand. Her fingers were cold and thin, and the skin was loose over the bones. I sat there for a long time. I didn't call anyone. I just sat and held her hand and felt the thing inside me settle. Satisfied, quiet, like a dog that has been fed and lies down by the fire. She lasted 10 days. My mother, who had been healthy and active and independent, was dead within 10 days of moving into my house. The death certificate said, complications of cerebrovascular accident. The real cause was that she moved in with her daughter, who was carrying something that ate the living. Mark was devastated. He'd been close to my mother. He helped me with the funeral arrangements, held me while I cried. And I did cry, genuinely, real grief, even as the thing inside me was satisfied and quiet for the first time since I'd left the hospital. And then Mark started getting sick. Chest pains, tightness, shortness of breath on exertion. Mark was 41 years old, ran 3 times a week, had blood pressure and cholesterol that his doctor called annoyingly perfect. He went for a cardiac workup. The results came back normal. EKG, echocardiogram, stress test, all normal. But the chest pains continued. They got worse. He started waking up at night, sitting up in bed with his hand on his sternum, breathing carefully. The way you breathe when you're afraid that a deep breath will trigger something. I watched this happen with the clinical detachment of a nurse and the horror of a wife. I knew what declining looked like. I'd watched it 260 times, and Mark was declining. Not fast. Not like my patients at Greenfield. Not the 13-day plunge. Slower, because he was healthy. Because his body was fighting harder than a 70-year-old cancer patient's body could fight. but the trajectory was the same downward slope, the same loss of vitality, the same graying of the skin and dulling of the eyes and slow retreat from the person he'd been. He stopped running. He stopped laughing as much. He went to bed earlier and slept later and woke up tired. He was 41, and he was aging in front of me. Weeks of decline compressed into days, and I could feel the thing inside me feeding on every increment of his deterioration. I recognized the pattern. The thing had moved on from my mother to the nearest available target, and the nearest available target was my husband. I told Mark to go stay with his brother for a few days. I told him I needed space to grieve my mother, which was half true. He didn't want to leave me alone, but I insisted. He held my face in his hands, those warm, rough hands, and looked at me and said, "I'm worried about you, Claire." And I almost told him, almost said the words. But what would I have said? That I was carrying something that was eating him alive? That every night he slept next to me, the thing in my chest was drawing the life out of him through some mechanism I couldn't see or explain? He would have called a psychiatrist. He would have been kind about it, because Mark is always kind, but he would have thought I was having a breakdown. So I said nothing. I kissed him. I watched him drive away. The chest pains stopped within 24 hours. He called me from his brother's house, amazed. "I feel great," he said, like it was never there. His voice was bright and strong and full of the energy that had been draining out of him for weeks. I could hear it coming back. The Mark I married. The one who laughed loud and ran fast and didn't think about his heart, because his heart had never given him a reason to. While Mark was gone, the girl next door got sick. Her name was Penny Wyatt, 9 years old, brown hair, gap-toothed smile. She rode her bike on the sidewalk in front of our house and waved at me when I was in the yard. I'd known her since she was 4. Penny developed a fever on the second day of Mark's absence, then fatigue, then joint pain so severe that her parents took her to the ER. The doctors suspected juvenile rheumatoid arthritis, or possibly Lyme disease. They ran tests. Everything came back negative. Penny got worse. She stopped riding her bike. She stopped going to school. She spent most of the day in bed, and her mother, Andrea, came over one afternoon to ask if I, being a nurse, had any idea what could be wrong. I stood in my doorway and looked at Andrea's face. The worry there was specific to mothers, not general anxiety, but a targeted biological terror that your child is sick and nobody can tell you why. Her eyes were red. She hadn't been sleeping. She told me that Penny had been fine, completely fine, running around the yard and eating everything in the fridge. And then overnight it was like someone had unplugged her. The life just drained out. She said the doctors were talking about a bone marrow biopsy if the symptoms didn't improve. She said the word leukemia, and her voice cracked on the second syllable. I stood there and I listened, and I felt the thing inside me react to Andrea's fear. Not her daughter's illness, the mother's fear. The specific, exquisite terror of watching your child sicken for no reason. The thing like that. It fed on the proximity of death, yes, but it also fed on the anticipation of death. The dread, the waiting, the helpless watching. All of those were appetizers for the main course. I knew exactly what was wrong with Penny. The same thing that had been wrong with my mother. The same thing that had been wrong with Mark. The same thing that had been wrong with 260 hospice patients and 3 med-surg patients and everyone who had ever gotten too close to me. I was what was wrong. I told Andrea I didn't know. I wished Penny a quick recovery. I closed the door. The next day, I packed a bag and drove to a motel 40 minutes outside of town. A place off the highway, cheap, anonymous. I checked in under my name and I sat on the thin, scratchy bedspread, and I didn't go near anyone. Within 3 days, Mark's chest pains had stopped completely. He went back to the doctor. The symptoms had resolved, no explanation, just gone. He called me and told me, and his voice was happy and confused, and I sat in the motel room and listened, and felt the thing inside me gnawing at nothing. Penny recovered. Andrea texted me that the fever broke and the joint pain disappeared overnight. A miracle, she called it. The doctors have no idea what it was. I knew what it was. It was distance. I had removed myself from proximity to living people, and the dying had stopped. But the hunger hadn't. In the motel room, alone, with no one nearby to feed on, the thing inside me turned inward. I could feel it, not as a presence, not as a separate entity, but as a part of me that was starving. It was in my chest, behind my sternum, a cold, hollow ache that pulsed with my heartbeat. It wanted. Not food, not water, not sleep. It wanted what it had always wanted. The process, the shutdown, the organ failure, the cellular collapse, the fear. The specific, irreplaceable experience of a human body ceasing to function. I stopped sleeping. Not because I chose to. Because every time I closed my eyes, I was back in Walter Tench's room, and his hand was on my wrist, and his lips were moving, and I was leaning in to hear what he was saying, and this time in the motel room dream, I could hear the words. He said, "Take it. I don't want it anymore." 5 words. That's all. 5 words spoken by a dying man to a 24-year-old nurse who didn't know what she was being given. Take it. I don't want it anymore. And I had taken it. Not knowingly, not willingly, but I had received whatever passed through his fingers into my wrist, and it had lived in me ever since, and it had been feeding for 11 years. Walter Tench had carried it before me. I understood this now, in the motel room, in the dark, with the hunger chewing at my insides. Walter had been a machinist. He'd worked in factories for 40 years. How many co-workers had gotten sick around him? How many neighbors? How many friends? How many family members had declined faster than expected while Walter was nearby, steady and calm and nourished by their dying? I thought about Walter's wife, sitting in his room every morning, reading the newspaper aloud. She visited every day for 11 days and she was fine. That was the thing. The host doesn't decay. The host is protected. The thing doesn't eat the person carrying it. It eats the people around the person carrying it. But it keeps the carrier healthy, functional, able to move through the world and find new targets. I was 38 years old and I had never been seriously ill. Not once. No cancer scares, no autoimmune issues, no infections that lasted more than a day. My colleagues joked about my immune system. Claire never gets sick, they'd say. They were right. I never did. Because the thing inside me wasn't interested in damaging its own vessel. Walter's wife was fine because the thing chose its targets deliberately, not randomly. It went for the most vulnerable. The sickest, the oldest, the weakest. In a hospice surrounded by dying people, it had a buffet. It didn't need to touch the healthy wife when there were terminal patients in every room. But when I left the hospice and went to the med-surg floor, the targets changed. No more terminally ill patients, just ordinary people recovering from ordinary procedures. So the thing adapted. It reached further, worked harder, found cracks in healthy bodies that shouldn't have had cracks. It manufactured the pulmonary embolism. It created the sepsis from nothing. It stopped Carlos's heart because it was hungry, and his heart was the most available thing to stop. And before Walter, someone else. And before that, someone else. A chain of carriers stretching back through years, decades, maybe longer. Each one hosting the thing until they were dying themselves, and then passing it on, grabbing a wrist, touching a hand, making contact at the moment of death, and letting the thing jump to a new host who would feed it for another lifetime. I thought about how many people in this chain there had been. Dozens? Hundreds? How far back did it go? Was there a first carrier? A patient zero? Someone who picked this thing up from somewhere that wasn't human? Or had it always been here, riding the species like a tick, jumping from host to host across generations, feeding on the dying of every era, plague victims, war casualties, famine deaths, the endless supply of human suffering that history provides? Walter tried to warn me. That's what the words meant. Not take it as a gift. Take it as a transfer. He was giving it to me because he was done carrying it, and he knew that someone had to. He knew, because whoever had given it to him had done the same thing. A chain of unwilling hosts, each one living with the hunger and the accelerated death and the fullness that came from being near the dying, until they themselves were dying and could pass it on. And now it was mine, and I was not dying, and I could not pass it on, and the thing was starving. I stayed in the motel for a week. I ate vending machine food. I didn't talk to anyone except the front desk clerk, a woman in her 60s who checked me in and left me alone. On day 4, she called in sick. On day 5, her replacement, a younger man, maybe 30, told me she'd been taken to the hospital with chest pains. I checked out immediately. The hunger during that week was the worst thing I've ever experienced. Worse than grief, worse than fear, worse than the guilt of knowing what I'd done to 260 people. The thing inside me was starving, and it let me know. Not through pain, through absence. A hollow, consuming emptiness that started in my chest and radiated outward until my whole body felt like a shell with nothing inside it. I couldn't think. I couldn't sit still. I paced the motel room like an animal in a cage, walking back and forth between the door and the window. And every time I passed the door, I felt the pull, the urge to go outside, to find someone, anyone, to be near a human body, and let the thing feed. I didn't eat for the last 3 days, not because I was choosing to fast, because the thing had turned its hunger on my body. My own body was the only thing available, and it was consuming me from the inside. I lost weight. My skin went gray. My hair started coming out in clumps. I found it on the pillow, on my shoulders, in my hands when I ran my fingers through it. My gums bled when I brushed my teeth. My nails became brittle and split. The thing was eating me the way it had eaten my patients. Slowly, systemically, shutting down one process at a time. If I had stayed in that motel room, I think it would have killed me. And maybe that would have been the end of it. But I didn't know that then. And the fear of dying alone in a motel while the thing jumped to the next host, the cleaning staff, a guest in the next room, drove me out before it could finish. I drove, not toward home, away from everything. North, into the rural part of the state, where the towns get small and the distances between them get large. I found a campground that was nearly empty, and I parked my car in a spot at the far end, away from the other campers, and I sat in the driver's seat, and I tried to think. The first night at the campground, I dreamed about my patients. Not the way I'd dreamed about them before. Not the vague, shifting dreams of rooms and faces. These were specific. I dreamed about Dorothy Sims, my second patient, who had embroidered pillowcases as a hobby. She'd brought 3 of them to Greenfield and put them on her bed, and they were beautiful. Delicate flowers in thread so fine it looked like watercolor. She died in 9 days, and her daughter came to collect the pillowcases, and her hands were shaking so badly she dropped one, and I picked it up, and when I touched it, I felt a faint residue of Dorothy in the fabric. Not a ghost, not a presence, just the warmth of a woman who had spent hours bending over her needlework. And now she was gone, and the pillowcases were all that was left. I dreamed about Robert Kang, who had been a high school chemistry teacher for 30 years and spent his last days in hospice explaining the periodic table to anyone who would listen. He died telling me about the properties of argon. Noble gas. Doesn't react with anything. Just exists, inert and harmless, filling space without changing it. I held his hand while he talked about argon, and I felt the thing inside me feeding, and his voice got softer and softer, until it was just his lips moving. And then not even that. I dreamed about James Oliveira and his wife's Cuban sandwiches, about Eileen Marsh and her rosary beads, about a man named Phil whose last words were, "Tell my wife I'm sorry about the garage," about a woman named Ruth who laughed at her own death, literally laughed and said, "Well, that was a ride." 260 faces. I dreamed about all of them, everyone. The math was simple. When I was near people, they got sick and died. When I was far from people, they recovered. The thing needed proximity. It couldn't feed through walls or across distances. It needed me close, physically close to its targets. So the solution was obvious. Stay away from people. Go somewhere remote. Live alone. But for how long? Forever? Was I supposed to spend the rest of my life in isolation, aging in some cabin in the woods, never touching another person, never being within 100 yards of another human being? And what happened when I got old, when I got sick, when I needed help? Would the paramedics who responded to my call get sick? Would the ER doctors who examined me decline? Would the thing pass from me to someone else the way it had passed from Walter to me, perpetuating the cycle? I couldn't live that way. And I couldn't die normally, because dying meant passing the thing on. The only person near me at the moment of my death would receive it. That's how it worked. That's how Walter had given it to me. And that's how it had been given to every host before him. The only way to stop it was to die alone. Completely alone. With no one near me. No one touching me. No possibility of contact at the moment of death. I thought about this for a long time. I sat in my car at the campground, and I thought about it as the sun went down, and the stars came out, and the other campers, a family with 2 kids, a retired couple in an RV, went about their evenings unaware that the woman in the Honda at the far end of the lot was carrying something that wanted to eat their dying. I thought about Mark, about the chest pains that had stopped the moment I left, about the years ahead of him, 20, 30, 40 years of life that he would have if I stayed away from him. I thought about Penny Wyatt, 9 years old, riding her bike again because I'd removed myself from the equation. I thought about the 260 patients, about their families, about the 570 combined years of life that had been consumed by the thing inside me, about Angie Reeves and her 2 boys, 16 and 14, doing their homework in the corner of the room while their mother died weeks before she should have, about the 16-year-old holding her hand, about the sound he made. I thought about my mother, dying in my guest room, 10 days, because her daughter was the most dangerous thing in the world and didn't know it. I drove to a hardware store the next morning. I was in and out in less than 5 minutes. I knew what I needed and I didn't linger. A shovel, a roll of plastic sheeting, a length of PVC pipe about 4 feet, 1 inch diameter, duct tape, a box of contractor trash bags. The cashier rang me up without looking at me. A teenager, maybe 17, bored and tired. I watched him for any sign of decline, a cough, a wince, a moment of dizziness. Nothing. 5 minutes wasn't enough. The thing needed sustained proximity to work. I drove out of town, further north into farm country, where the properties were large and the neighbors were distant. I found a spot about a mile off a county road, behind a tree line, on land that didn't appear to belong to anyone specific. Tall grass, hard-packed clay soil beneath, no houses visible in any direction. I started digging. I'm not going to pretend this was a rational decision. I know what it sounds like. I know that a reasonable person would have gone to a doctor, a psychiatrist, a priest. I know that the rational response to, I think something inside me is killing people, is to seek professional help, not to dig a hole in a field. But I had spent 11 years watching the professionals not notice. 260 patients, 570 years. No doctor, no administrator, no investigator had ever connected my presence to the accelerated deaths. The data was there, in my notebook, in the facility records, in the charts and the notes and the death certificates. Nobody looked at it. Nobody put it together. Because nobody looks for a nurse who kills patients by existing near them. There's no diagnostic code for that. There's no protocol. There's nothing in the medical literature that describes what I was carrying. I dug for most of the day. The soil was hard and my arms ached and my hands blistered and bled, and I kept going. The clay was dense, packed tight, and every shovelful felt like I was arguing with the ground. By the 3rd hour, my blisters had broken and the wooden handle of the shovel was slick with fluid and blood. I wrapped my hands in strips torn from my shirt and kept digging. The hole got deeper. The walls got taller around me. The light changed as the hours passed, morning to afternoon to the long golden slant of early evening. I hit a rock at about 3 feet and had to pry it out with the shovel blade. It was the size of a football, smooth and heavy, and when I lifted it out of the hole and set it on the grass, I stood there for a minute just breathing. My back was screaming. My shoulders were locked up. I hadn't eaten since the day before, and my blood sugar was low enough that the edges of my vision were sparkling. But I kept going. I dug until the hole was roughly 7 feet long, 3 feet wide, and 4 feet deep. Not deep enough to be a proper grave, but deep enough. The sides were rough, the bottom uneven. I wasn't trying for precision. I was trying to disappear. I lined the bottom and sides with the plastic sheeting. I taped the seams with duct tape. I took the PVC pipe and duct taped it vertically so that one end would be near my face and the other end would extend above ground level. An air tube. Not because I wanted to survive, I didn't, but because I needed to die slowly. The thing fed on the dying process. If I died too quickly, a gunshot, a hanging, a jump, I wasn't sure the thing would die with me. It needed the process, the shutdown, the fear, the slow failure of systems. I needed to give it what it wanted, one last time, in a place where there was no one else for it to jump to. I sat at the edge of the hole for a long time. The sun was going down. The field was quiet. I could hear insects and wind and nothing else. No people, no voices, no heartbeats within range of whatever radius the thing used to feed. I called Mark. He picked up on the second ring. Claire? Where are you? I've been calling. I know. I'm sorry. Are you okay? Linda said you quit. Your mother. I mean, everything's been... Claire, what's going on? I need you to listen to me and not interrupt. He was quiet. Mark is good at that. When he hears a certain tone in my voice, he stops and listens. I told him that I loved him. I told him that leaving was not about him. I told him that there was something wrong with me that couldn't be fixed by doctors or medicine or therapy, and that the only way to keep him safe was to stay away. I told him not to look for me. Claire, you're scaring me. I know. I'm sorry. Just tell me where you are. I'll come get you. We'll figure this out. You can't come near me. Promise me you won't try to find me. I'm not going to promise that. Mark, promise me. The silence on the line was long and terrible. I could hear him breathing. I could hear the television in the background. He was at his brother's house watching something, having a normal evening, living his life, a life that would continue after tonight, a long, healthy, full life, because I would not be in it. I love you, I said. Claire. I hung up. I turned off the phone. I took out the battery. I put the phone on the ground next to the pile of dirt. I got into the hole. The plastic sheeting was cold against my back. The sides of the hole were close, not touching me but close, walls of dirt and clay that smelled like iron and rain. Above me, the sky was a rectangle of deep blue going dark at the edges, the first stars appearing. I adjusted the PVC pipe so that it was near my mouth. I could breathe through it. The air coming down the pipe was cool and tasted like grass. I lay there for a while before I started. Just lay in the hole and looked at the sky and thought about everything. About my career, which I had chosen because I thought I was good with death. About the patients, all 260 of them, who deserved more time than I gave them. About Angie Reeves's boys. About my mother, who raised me alone after my father left, and who deserved to die in her own bed at 85 or 90, surrounded by the people she loved, not in her daughter's guest room at 74, 10 days after walking through the door. About Mark, who was probably sitting at his brother's kitchen table right now, holding his phone, wondering why I wasn't answering. I thought about the thing inside me. I tried to feel it, to locate it, to understand what it was. It wasn't in any specific organ. It wasn't a mass or a growth or a foreign body. It was distributed, threaded through me the way marbling threads through meat. It was in my blood, in my nerves, in the electrical impulses that traveled between my brain and my body. It was part of me in a way that couldn't be surgically removed or chemically destroyed. The only way to kill it was to kill the system it lived in, which was me. I thought about whether I was insane, whether this was all a story I was telling myself to explain a pattern that was just coincidence, just bad luck, just the normal statistical variation of human mortality that I'd interpreted through the lens of grief and guilt and loneliness. Maybe I was a normal nurse who had normal patients who died at normal rates, and I was about to bury myself alive in a field based on a delusion constructed by a mind that couldn't handle the weight of 11 years of watching people die. Maybe. But I didn't think so. The numbers were too clear. The pattern was too consistent. And the feeling, the nourishment, the fullness, the satisfaction of being in a room where someone was dying, that wasn't something a healthy mind invents. That was something being fed. Then I started pulling the dirt in. I'd piled it along the sides when I was digging, so it was right there, within arm's reach. I pulled it in with my hands, handful by handful, covering my legs first, then my torso. It was heavy, heavier than I expected. Each handful landed on the plastic sheeting with a dull thud and settled into the spaces around my body, pressing in, conforming to my shape. I covered myself up to my chest, then my shoulders. Then I was working mostly by feel, reaching up and over the edge of the hole, pulling dirt down onto myself. I couldn't see the sky anymore. The dirt was over my face, around the pipe, pressing against my cheeks and forehead. The weight was enormous, not painful, but total. Every part of my body was compressed, held in place, unable to move. I breathed through the pipe, slow, steady breaths. The air was thin. The pipe was narrow and I had to work to pull enough through it. My heart was pounding, not from exertion, from fear. Real, animal fear. The kind that bypasses every rational thought and goes straight to the brainstem. I was buried alive and I was going to die here, and every cell in my body knew it and was screaming at me to move, to dig out, to claw my way back to the surface. I didn't move. The thing inside me was awake. I could feel it, not hungry anymore, not reaching outward for targets, confused, agitated. It was used to feeding on other people's dying, not on mine. But I was the only one here, the only body within range. And my body was dying, slowly, deliberately, exactly the way I'd planned. The fear was first. The thing ate that. I could feel it consuming my terror the way fire consumes paper, taking it in, breaking it down, converting it to whatever sustenance it needed. The fear didn't go away, but it changed. It became less mine and more the thing's. Like watching someone else be afraid through a window. Then the cold. The ground was cold and I was lying in it, and my body temperature was dropping. Not fast. The plastic sheeting provided some insulation, but steadily. My fingers and toes went numb first, then my hands and feet. The thing fed on that too. The sensation of systems shutting down, of extremities being abandoned by a body that was conserving resources for the core. Then the air. The pipe was providing oxygen, but not enough. Not nearly enough. My breathing became shallow and fast and then shallow and slow. and the edges of my consciousness started to blur. Carbon dioxide building up, oxygen dropping. The thing fed and fed and fed, gorging itself on the process, on the biochemistry of a body failing by degrees. I don't know how long I lay there. Time stopped being linear. I was in the dirt, and I was in Walter Tench's room, and I was in 100 rooms at Greenfield, sitting with patients whose lives I was shortening just by being there. I was holding Angie Reeves's hand while her 16-year-old son held the other one. I was standing in my mother's room, watching her breathe, knowing that each breath was bringing her closer to a death, that my presence was accelerating. I was in all of those rooms at once, and in none of them. I was in the ground. The thing inside me was dying. I could feel that too. Not the way a disease is cured or a parasite is killed. More like the way a fire goes out when you remove the fuel and the oxygen simultaneously. It was still feeding on me, still drawing from the process of my body shutting down. But there was no one else. No next host. No wrist to grab. No hand to touch. It was consuming itself through me, eating the last meal it would ever have. And when I was gone, it would be gone too. I hope. I can't be sure. That's the thing I keep coming back to, here in the dirt, with the last scraps of oxygen bleeding through the pipe and my thoughts getting slower and softer and more scattered. I can't be sure that it dies with me. Maybe it doesn't need a host. Maybe it can survive on its own, in the soil, in the ground, waiting for the next person to walk over this spot. Maybe it seeps into the water table and finds its way into someone's well, someone's tap, someone's body. Maybe I did this for nothing. The pipe, the air tube. I left it sticking up above the surface. A 4-foot length of white PVC pipe standing in a field behind a tree line, a mile off a county road. If someone finds it, a hiker, a farmer, a kid exploring, they'll be curious. They'll pull it up. They'll dig. They'll find me. And if I'm not dead yet, if there's still a flicker, still a heartbeat, still a trace of the process happening in my failing body, the thing will have one more chance, one more pair of hands touching mine, one more transfer. I should have cut the pipe shorter. I should have buried it completely. I should have made sure there was no way anyone could find me until it was too late, until I was bones and dust and the thing had starved to nothing. But I didn't. I left the pipe. 4 feet of white PVC, visible above the grass line, catching the light. I can feel myself going now. The edges are closing in. The fear is almost gone. The thing has eaten most of it, leaving behind a numb, floating emptiness that might be peace or might be the last stage of oxygen deprivation. I can't tell the difference. I'm not sure it matters. My last thought, before the dark comes all the way in, is about Mark. I think about his face. I think about the way he rubs his eyes in the morning before his glasses are on, squinting at the world like it's personally offending him. I think about his hands, warm and rough from construction work, and how they feel on my shoulders when he's standing behind me. I think about the sound of his voice when he said, "Claire, you're scaring me." And I wonder if he's looking for me right now, if he broke his promise, if he's driving north, checking roads, asking strangers if they've seen a woman in a Honda. If he is, I hope he doesn't find the pipe. I hope he doesn't dig. But the thing inside me, the last shred of it still alive in my chest, going dark, going cold, it hopes he does.